Hi Farmies, I have two meds for you today. The first one is going to be an inhaled anticholinergic, and that one, in case I try to think of what it's going to be, Ipratropium, Atrovent. And the next one is a beta-2 adrenergic agonist. And so that one is going to be Albuterol. It's a short-acting asthma medication. All right, so how are we going to remember the classes of these drugs? Let's start with Albuterol. Okay, so Albuterol is going to be used for asthma and COPD. They both are, asthma and COPD. But it binds to beta-2 receptors, and that causes a relaxation in the smooth muscle of the airway. It can have the same kind of reaction that you get with the fight or flight adrenergic sympathetic response. So you can have tachycardia, angina, tremors. You can also you have to remember that this is the one that is the rescue inhaler. It is what your patient needs when you have an asthma attack and you want to open it up. So how you give that depends on how quickly you need to open it up. If you're just starting to have some asthma symptoms, you can take a couple of puffs of your inhaler. If you're in the emergency room, you might want to use a breathing treatment. It might be actual breathing treatment instead of just one puff on an inhaler. It would be a longer term because you're trying to open up those airways. All right, so how are we going to remember that Albuterol is a beta adrenergic rescue medication? So I have a way for you to remember this. I want to introduce you to Albuterol. So here's Al. He's a fireman and he's rescuing a beta fish. So you have to remember that Al is rescue medication, Albuterol to the rescue, and it is a beta adrenergic agonist. All right, so you can think of all the fight or flight, it's all that drama, rescue, Albuterol. Okay, so there's Al and his beta fish. The next one I want to talk to you about is Ipratropium. It's Atrovent, also COPD and asthma, but this one works a little differently. It blocks ACH receptors, acetylcholine receptors, in the airway smooth muscle and causes bronchodilation. Because it has anticholinergic effects, they're similar to sympathetic system effects. It causes dry mouth, hoarseness, so you may want to have some sugar-free candy if you end up with a dry throat from this inhaled medication. All right, so how are we going to remember that Ipratropium is an anticholinergic? That's what I came up with. Ipratropium, see the little ants? They're carrying Ipratropium on a log. It's kind of a long word. And they're thinking about asthma and COPD. They're going to take that medication. Now, the reason I did Albuterol first, you have to meet Al first because we have to give Albuterol before we can give Ipratropium. Remember, we have to use the rescue medication first. He's got to go in and put out the fire, rescue the beta fish, and then we can come along with our next medication, Ipratropium. All right, so there's your little anticholinergic, Ipratropium. Beta to the rescue, Al to the rescue, beta adrenergic agonist. All right, I hope that helps you remember your two asthma and COPD medications.